Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick nod whether the audio visual is all good. Okay, that's great. So, first of all, wishing you all a very, very happy Guru Purnima. Heartfelt thanks to each one of you for the lovely wishes and for keeping me motivated day in and day out to learn something new and in a different way so that I can deliver you in the best possible way. So, happy Guru Purnima, everyone. And so, on that positive note, let's start the today's session. So, basically, if you go back and check the First Aid USMLE book, page 297 is basically where you'll be seeing the graphs that we are discussing in the section of cardiology, right? In the section of cardiology. So, these are basically the graphs today that I'm focusing on. I believe because of the time constraint today, so I'll be doing this in two parts, part 1 today and then part 2 again tomorrow at 5 p.m. right? Because if time allows, I'll do it completely. If not, then we'll do it in two parts. So tell me, right. So anybody who can identify here this graph, I put this as a question mark in the thumbnail itself. Tell me what valvular disease is this? If the dashed line is showing the normal pressure volume loop, what is this graph showing? Is it aortic stenosis? Is it aortic regurgitation? Is it mitral stenosis? Or is it mitral regurgitation? What is that? All right, we'll come back to this question later on. You can keep thinking till then. Yes, and we can stay connected on Insta, YouTube, Telegram, or the Unacademy profile. On Telegram group is basically where we are following the new timetable and the daily targets, and you have a daily pre-test and a post-test based on the daily targets. Today we have CNS and neuromuscular physiology. Okay, we'll come to the correct answer later on after we discuss this topic. Some of you have got this right, some of you have got this wrong. I hope after the session, each one of you will get that right. Okay. So starting with the first question related to the pressure volume loop, a quick review of this pressure volume loop, and then we'll go into the valvular diseases. So tell me, mitral valve opens at which point? At which of the following point does the mitral valve open? Is it A, B, C, D? Apurva, we have already done that, the regulation of respiration, the neural regulation basically I have taken recently. You can check it on, I've taken on YouTube itself. You can check the link in the Telegram channel. If there's anything else that you want to know and you want me to discuss, please let me know. Okay, so the question is at which point the mitral valve opens? Thank you so much, Divya. I'm so happy to know you got all questions correct after attending the yesterday's class. See, mitral valve opens. Now, how you should be cracking these questions basically is, सबसे पहले तो when you have a question कि this valve is closing or this valve is opening, think about what phase of the cardiac cycle is starting. When the mitral valve, right, you remember the schematic diagram yesterday that we had discussed the cardiac cycle? For anyone who did not watch the yesterday's class, please do it to understand the basics. Okay, so when the mitral valve is opening, so basically the blood will go from the atrium to the ventricle, right? So what is happening there? What is happening there? The ventricular filling is happening. That means the diastole phase, the ventricle will receive the blood, right? So basically the volume of the ventricle, the volume in the ventricle is increasing. Where is the volume? The volume is on the x-axis, the left ventricle pressure is on the y-axis. At which point the volume is increasing? In this area basically, right? So from point D to point C is where the volume of the ventricle is increasing. That means it's a filling. That means this is the point D where the mitral valve is basically opening. Okay, this is the point where the mitral valve is opening. Clear with everyone? Right, so this is the opening of the mitral valve. Now tell me what valvular event is happening at this point B. So if I have to quickly tell you about the LV pressure volume loop, see, the y-axis basically shows the pressure in the ventricle, and this is the direction. Okay, this is the direction of the pressure volume loop. So at this point, point C is where the pressure, okay, where the pressure, okay, so that is what, Farah, we are talking about. It's not point A to B, the curve is going in this direction. Okay, so if I have to put the directions here, so the curve is going from this direction to this direction and this direction and this direction. The volume is increasing here. It is not point A to B, it is point B to A where the volume is decreasing. When the volume will decrease in the left ventricle, when it is giving the blood to the aorta, that means the systole, the systole, the ejection phase. So basically at this point B, what is happening? This door is opening, right? The aortic valve, right? It is the aortic valve which is opening. And that is when the ejection starts. When the ejection is over, the point A, what will happen? The aortic valve closes. And that is when the diastole again starts. What is this phase of the diastole? Basically this phase. At this phase, you can see that the pressure of the ventricle is going down. It is downward direction. But the volume is the same, right? The volume is the same. It's a straight line. The volume is not changing. So basically, this is isovolumetric relaxation. Okay, this is isovolumetric relaxation. Similarly, C to B is the point where the pressure is increasing, but the volume is the same. Same volume means isovolumetric, pressure increasing, so it is contraction, right? So it is contraction. So now tell me that which is the point where the systole starts? Systole starts at which point in this graph? If I ask you systole starts at which point, what will be the answer? Systole matlab contraction. Okay, remember systole basically means contraction. So contraction means the pressure increasing. Isovolumetric पहले आएगा. कहाँ से pressure increase होना शुरू हो रहा है? From the point C. Right? So the systole is starting at point C. Diastole is starting at which point? Diastole relaxation, pressure going down. It is starting from the point A where the pressure is going down. Okay, the pressure is going down. So that is the point A. Clear with everyone? So basically, if I ask you from which point to which point is systole and which point to which point is diastole, I hope you remember from the yesterday's class that the initial part is isovolumetric in both. So basically, this is the systole starting, pressure increasing, and this is the ejection. So point C to B and then point A. So basically, C to A is systole and A to D to C. This part is basically the diastole. Initial isovolumetric, then there is the filling phase. Okay. I have already shared the PDF of this on the Telegram group, right? If you want to make the notes, you can see that. So absolutely right. So if I draw a line here, ये जो आधा आधा है, so this is the systole and this is the diastole here. Okay, so this is the systole and this is the diastole. Now yesterday's mnemonic, if you remember, Coco ma'am, right? Coco ma'am, the valvular events. Closure of mitral, opening of aortic, closure of aortic, then you have opening of mitral. So at which point is the mitral valve closing? So just remember that schematic diagram कि mitral valve close हो रहा है, right? That means the filling is over. So next we'll start the systole. So closure of mitral valve is basically the start of systole. So what is the point where the mitral valve is closing? What is that one? Right. So that is the point C. So if this is the point C, which is closure of mitral. So next one is opening of aortic, right? Next is closure of aortic and next is opening of mitral valve, right? So this is where you have COCOMAAM, that is Coco ma'am. The Coco ma'am basically starts here in the LV pressure volume loop. If you remember the yesterday's graph, the Wiggers diagram, here the Coco ma'am starts here. The closure of mitral, right? COCO, then you have MAAM. Then you'll have opening of aortic, closure of aortic, opening of mitral. That was in the Wiggers diagram. Here at this point is where the Coco ma'am starts. Okay, at this point is where the Coco ma'am starts. All right. Clear with everyone? So this is about the pressure volume loop. Now look at these points. What does this indicate? What does the width of the pressure volume loop indicate? So this volume, okay, if I ask you what is this volume indicating? Okay, you have two volumes of the ventricle here, एक ये वाला volume और एक ये वाला volume. So this volume that you see here, is this end systolic volume or end diastolic? What is ending at this point? It is the diastole which is ending at this point, right? Because from this point to this point, this is systole. So this is the end diastolic volume and this is the end systolic volume. The systole is ending here. So this is the end systolic. So what is the formula for stroke volume? It is end diastolic minus the end systolic. So basically the subtraction, 120 minus 50 approximately equal to 70. So this is a numerical question that you get on this graph. Calculate the stroke volume from this graph. So basically you have to look at the width of the graph. Okay, you have to look at the width of the graph. That is the stroke volume. EDV minus the ESV. Right, stroke volume means what is going out with one ejection. That's the stroke volume. So how much it is received minus how much goes, how much is remaining. So that is what is going out. Okay, clear with everyone? So that is EDV minus ESV. All right. Now, going to the next one. Okay, going to the next one here. These are the valvular events given. Let me show you this graph here. This is what we have already discussed. This is the stroke volume. This is isovolumetric contraction, ejection. Then this is isovolumetric relaxation and the filling phase. This is the end diastolic volume and this is the end systolic volume. Okay. And these points basically represent the aortic pressure, systolic and the diastolic. Look at the points where the aortic valve closes, that is the systolic. Where the aortic valve opens, that is the diastolic pressure. Okay, that's your pulse pressure basically utna aega. Okay. Now, look at this. This graph is basically that I'll be discussing tomorrow in the part 2. ये थोड़ा सा इसमें ज़्यादा discuss करना पड़ेगा with the details. I'll do that tomorrow. Let us, so basically this is from your first aid. Okay. Now let us discuss the effect. Now this is what you would love. I believe this is what you would love here basically. And that is identifying the changes in the valvular diseases. Okay. So if I show you these 4 images, rather than 4 images, let me start one by one. Tell me, what do you think is this valvular lesion? Is it aortic stenosis, aortic regurgitation, mitral stenosis or mitral regurgitation? Write this down because this is something which is very, very important. Tell me, what valvular lesion is this? The live chat and the... Let me see what happened. All right. Tell me, what do you think is this one? Okay. So quick tips here. The mnemonics to be remembered. Very, very important mnemonics here is basically remember that whenever it is stenosis. Okay. This is very important trick. Whenever it is stenosis, remember the graph becomes thin. Sten is thin. Okay. So basically stenosis means the graph becomes thin. That means what is happening? From the normal width, now the width becomes this much. So when the width of the graph is decreasing, basically what is decreasing? The stroke volume is decreasing. Okay. The stroke volume is basically decreasing. So be it aortic stenosis, or be it mitral stenosis, the graph will become narrow. It will become thin. Right. So this black line here represents a normal graph. Look at the normal stroke volume. This pink one is the valvular lesion ka graph. You can see the stroke volume is reduced. So it is stenosis. It is not regurgitation. That is what you need to remember. Now, whether this is aortic stenosis or it is mitral stenosis, how will you know that? Another trick to remember here, aortic lesions versus mitral lesions. Okay, so aortic may, remember the shift is to the right, the graft shifts to the right. In mitral, you have L there, right? Do not confuse with the R. Aortic does not have L. So aortic is right, mitral is the shift to the left. So from this point, you can see that where the graph has shifted. Has the graph shifted to the right or the graph shifted to the left? Where has the graph shifted from the normal? The graph is shifted to the right. Right. So that is why the answer here is aortic stenosis. Now, what point tells you that this is aortic stenosis? What point tells you that this is aortic stenosis? So see, aortic stenosis basically is this door is very narrow. So the left ventricle has to pump out with a narrow, through the narrow door. It has to increase the pressure to push against that narrow door, right? We'll have to push more. So more pressure needs to be created. So look at the maximum pressure here and look at the maximum pressure here. The height of the graph is increasing. Okay, so that is why this is aortic stenosis. Basically, the after load is increasing. Okay, so remember that the height is increasing, it is becoming stenosis is thin, and aortic is right. Okay, aortic is right. Okay, so that is your aortic stenosis. Now apply the tricks: stenosis thin, aortic right, mitral left. Only this is what you need to remember. This is the crux of how to identify. Stenosis is thin, aortic is shift to the right, and mitral is shift to the left. Now tell me, what do you think is this one? What valvular lesion do you think is this? Is it aortic stenosis? Is it aortic regurgitation? Mitral stenosis, mitral regurgitation? Absolutely right. So first of all, you can see the width of the graph is increased. It is wide, so it's not stenosis. So no stenosis, no stenosis. It's a regurgitant lesion. The graph has shifted to the right. It is the rightward shift. So rightward shift is aortic. It is not mitral. So the answer is aortic regurgitation. In medicine, we read about the various clinical signs in aortic regurgitation. They are basically due to wide pulse pressure. That is a very important feature of aortic regurgitation, the wide pulse pressure. So this is the systolic maximum wala. You have the diastolic here. You can see that the pulse pressure will be significantly high, basically in aortic regurgitation. Okay. So Anju, as I said, the details of preload and afterload, जो ये वाला graph था आपका first stage से, I'll be discussing this tomorrow. Preload, afterload, and contractility. What is the effect of that, and how do you identify in the pressure volume loop? Okay. Today I'm just telling you the quick tricks of the valvular lesions PV loop. Okay. Now identify this one: AS, AR, MS, MR. What do you think is this? Apply the trick. Stenosis is thin, aortic is right, mitral is left. What do you think is this valvular lesion here? Very good. So this is thin as compared to the normal. Thin is stenosis, right? This is stenosis. So regurgitant is out. It is not a regurgitant lesion. Regurgitant will have increased stroke volume. The width will be more. Where has the graph shifted as compared to the normal? The graph has shifted to the left. So this is mitral stenosis. The aortic will be to the right. Right. Also in aortic stenosis, the height will increase. The pressure will increase significantly. So this is mitral stenosis. Okay, this one is mitral stenosis. Clear with everyone? Give me a quick thumbs up if you have understood this. Easy tricks to identify which valvular lesion it is. Right. Just remember stenosis, aortic right, mitral left. Okay. Now, what lesion is this? Aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation. Remember, I can give you a repeat image also. See, first of all, the graph has gone. Okay. First of all, what do you see here? The graph has become wide. It's not thin. So that is why it is not stenosis. It is regurgitant. The graph has shifted to the left. If you compare this, basically it has shifted to the left. So this is mitral regurgitation. Aortic will be to the right. So this is mitral regurgitation. Aortic वाला regurgitation वाला जो graph है वो right में जाएगा. Remember, when you write aortic, it will go towards right. Let me show you aortic regurgitation. Look at this. In aortic regurgitation, this is going towards the right. Okay, it's going towards the right. Okay, clear with everyone? All right. So let us quickly see this. Okay, let us quickly see this combined. Okay, so you have graph A, you have graph B, graph C, and graph D. Okay, applying the tricks. This one is thin. Okay, so this one is thin, and you see that it has shifted to the right. So thin with shift to the right. So that makes it thin is stenosis, right is aortic. So this is aortic stenosis. Okay, this is aortic stenosis. This one, the width has not decreased, it has increased. So it is not stenosis. So it is regurgitation. The line has gone towards the rightward shift. It is right. So this is aortic regurgitation. Okay, this one is aortic regurgitation. Okay, where you see that again it is thin. So this is stenosis, thin is stenosis, and you see the line has gone to the left. So this is mitral stenosis. Okay, this is mitral stenosis. Here you see that the width has increased, so it's not stenosis. Okay, so Bharti, that's what you have to compare for the right shift and the left shift is this volume. Okay, what volume is this basically here? This is the end systolic volume. Okay, we are talking about the end systolic volume is what you have to see, whether it's going to the right or to the left. We are not talking about the end diastolic volume. Okay. So यहाँ पे आपका जो graph है, the end systolic, the line is shifting towards the left. So this is mitral. It is not thin, it is wide. So this is mitral regurgitation. Please do not look at the end diastolic volume. Look at the shift of the end systolic volume. Okay, look at the shift of the end systolic volume. ठीक है? Now applying this, basically, if I ask you that what happens, okay, what happens to end systolic volume, okay, what is happening to the end systolic volume in aortic regurgitation? In aortic regurgitation, the end systolic volume is decreasing or increasing? Yes. So just you have to apply here कि हमने जो बोला कि जो aortic वाले lesions है, aortic वाले में the graft is shifting to the right. The graft, the line that we are talking about is the end systolic volume going towards the right. That means the end systolic volume is increasing. So basically in mitral, it is leftwards shift. That means the end systolic volume is decreasing. Let me see if I have that image here. Okay. So look at this one. Okay. So look at this one basically. Aortic stenosis, the end systolic volume is increasing. Okay, the end systolic volume is increasing. Mitral stenosis, mitral regurgitation, leftward shift, the end systolic volume is decreasing. Okay, the end systolic volume is decreasing. Clear with everyone? Right? Is this clear with everyone? Okay, the next point, if I ask you mitral stenosis versus mitral regurgitation, in which of these the end diastolic volume, okay, in which of these the end diastolic volume increases? In which of these the end diastolic volume decreases and in which of these the end diastolic volume decreases? So think about the end diastolic volume is this one. When I say increasing, that means it is more wide. When I say decreasing, that means it is becoming thin. right? So end diastolic volume decreasing, matlab the graph is becoming narrow, it is thin. So this is going to be stenosis. End diastolic volume increasing, that is stroke volume yahan se aapka badhega. So this is basically your mitral regurgitation. So look at this one. Mitral regurgitation, you can see the end diastolic volume, EDV is increasing. In your mitral stenosis, the end diastolic volume is decreasing, right? It is decreasing. Clear with everyone again? Okay. So basically what is happening in stenotic lesion? Stenosis is thin. So that means the stroke volume is decreasing. Regurgitant is wide. That means the stroke volume is increasing. So these points, EDV, ESV and stroke volume are clear with everything. This is from your first aid itself. Going to your aortic stenosis. When I say stenosis is thin, that means the stroke volume is decreased. When I say regurgitant is wide, that means the stroke volume is increasing. Right? The stroke volume is increasing and you have the increase in the end diastolic volume also. Okay, you have increase in the end diastolic volume. Clear with everyone? Okay, is this clear with everyone? Okay, so this was the quick review of the pressure volume loop, the effect of the valvular lesions. So this is what the graph is. So thin with shift to the right aortic stenosis, thin with shift to the left mitral stenosis, wide with shift to the right, it is aortic regurgitation, wide with shift to the left, that is mitral regurgitation. Okay, that is mitral regurgitation. So in both of these, basically the end systolic volume is decreasing. Here, the end systolic volume is increasing. Okay, the end systolic volume is increasing. Okay. All right. So as I said, for today, we'll be doing this part 1. Tomorrow, I'll be discussing this complicated graph. What is the effect of preload, afterload, contractility? How will you identify the graphs? And also this from your first aid, basically. How do you identify the valvular lesions on the Wiggers diagram? Very, very important for INICT exam. Wiggers diagram, kaise identify karoge? That is what we'll be seeing tomorrow. Okay, so that will be the plan for tomorrow evening. Okay, we are meeting again today at 8 p.m. basically for the respiratory physiology graphs, right? The important graphs in respiratory physiology is what we'll be doing at 8 p.m. with MCQ discussion as well. So hoping to see you all on the Unacademy app. It's a free live class. It's a special class which is free live class at 8 p.m. If you are asked for the code to join, you can use the code Dr. Nikita. So some easy tricks to decode the respiratory physiology graphs. All right. So I hope this confusing topic has become easy. What happens in which valvular lesion, the ESV and the EDV has become easy for you. Okay. Thank you so much everyone for joining in. See you at 8 p.m. Till then, goodbye. Take care and keep studying, keep revising and keep winning. And happy Guru